In today's episode of the podcast, you get a solo episode of me helping you understand how to fix your period with your fundamentals. So we understand simply what your menstrual cycle is trying to tell you, whether it's a red flag, meaning you need to go and seek medical help, a beige flag, meaning, hey, you haven't given your body what it needs. So how do you support your fundamentals? And green flags. So green flags from your body mean, oh my gosh, you've been doing everything it needs to be able to function well and it is loving you. So if you've ever felt confused or overwhelmed when it comes to your menstrual cycle, whether you're getting pain, irregularity, heaviness, or going, I think my menstrual cycle's fine, and you're just unsure, listen to today's episode because we make it so simple and easy to understand what your body's trying to tell you through your menstrual cycle. And if you do have symptoms, how you can fix it using your fundamentals. If you've ever felt dismissed, confused, or stuck in the space between symptoms and answers, you're not alone. This is What's My Body Telling Me, with me, Dr. Anthea Todd, the podcast where we believe your body isn't the problem, it's the solution. Together, we'll explore how to understand the messages your body sends through symptoms, how to support yourself through every stage of life, and why functional health, medicine, and energetics are all key to understanding and supporting your body. Here, we let feeling good become the baseline because life's too short to feel anything but alive. So, are you ready to start listening differently? Let's get into today's episode. Welcome back if you are joining us again, and welcome if this is your first episode. I'm Dr. Anthea Todd, and today I wanted to help you listen to your body differently when it comes to your menstrual cycle. So I have been seeing a lot of one-on-one patients lately, but also have people in my life that are experiencing menstrual cycle difficulties, whether it's pain, whether it's irregularity, whether it's not even knowing whether it's heavy or not, because no one really explains to you how many tampons is normal to use throughout the day. Is it normal to bleed through? Is it normal to have clots? What is actually normal and what's not? And this is the space that we find ourselves in and why it can sometimes feel a little bit overwhelming and consuming when we're trying to figure out what the hell our body is trying to tell us. But in today's episode, I just really wanted to make that really simple and easy. So if you haven't already read my book or listened to, I believe it's the second episode of this podcast, I talk about what are called red flags, beige flags, and green flags. And what these are is basically categories that you can put your symptoms into that help you understand what type of help does my body need? Because our symptoms are literally just our way of our body trying to tell us something. So red flags are signs and symptoms from your body that you need medical support, whether that's more blood test investigations, different scans, whether you possibly need medication or surgery quite soon. Beige flags are signs from your body that it's not bad enough to need medication or surgery, but you're also heading down the path that your body doesn't like what you're doing. And if you continue to do that, that's when chronic conditions can start to come about, and that's when we can receive a diagnosis of a chronic condition. Because chronic, remember, takes time to come about, and we're missing the beige flag signs. And green flags are signs and symptoms from our body that it is loving what we're doing. So this is how we're going to make the menstrual cycle really simple and easy to understand. Red flags, it means you need some further investigation, particularly when we're looking into medical causes of what your symptoms are trying to tell you. Beige flags are, hey, you need to support your fundamentals. Your fundamentals are how we support the function of our body. And then finally, green flags are, oh my gosh, your body is absolutely loving what you are doing. And it's telling you so through your menstrual cycle. It's telling you everything you need to know, or the majority of what you need to know, through all of your symptoms. So let's understand it through your menstrual cycle. I want you to remember that each of these flags changes depending on the life stage that you're in. Meaning, if you don't have a period and you're 30 and not pregnant versus you're 70, we know that it's normal, aka a green flag, to not have a menstrual cycle bleed or a period when you're 70. But it isn't normal or a green flag when you're 30. Much like it's not normal to have a period when you're 4 years old. So this is where we need to understand, okay, what are the red flags, beige flags, and green flags for each stage of my life? Because as women and men, but largely as women, when we move into the different stages of our life, our symptoms are going to change. And it doesn't necessarily mean that there's something wrong. It might just be signifying that we've moved into a different stage of our life. So let's talk about red flags first. So between puberty and perimenopause, that's your reproductive age, and we're removing the fact that you might be pregnant. We're not talking about pregnancy or fertility in this episode, purely just these flags. So if you get your period before the age of 9, then this is a red flag. This is a sign that we need to go and speak to our doctor. There can be different causes that are different things internally that are causing this, meaning brain issues, ovary issues, or something else internally. Now, if you do get it earlier than 9 years old, and the women in your life also did too, meaning your mum did, meaning your grandma did, or you also have long femurs. So if you are a long-legged girl that has a long femur, which is your thigh bone, this is correlated to getting your menstrual cycle early. If you don't have them and you get your menstrual cycle early, this can often mean that there are other sources of estrogen in your environment. So that's things like plastics, Tupperwares, sprays, different things in your environment that are mimicking estrogen in your body. So we need to look out for that. So going to your doctor to get the investigations is always a helpful thing. Now, if you are in perimenopause, what are some red flags here? So if you're in perimenopause phase and you are getting bleeding that's flooding, meaning you are needing to change your tampon more frequently than every 2 hours. And I know this happens a lot for people. This is a red flag. This is a sign that you need to go and see your doctor, and they need to do some further investigations. There could be things like uterine fibroids. There could be other causes like cancers, like growths. There could be imbalances in your thyroid. It's important to go and get some bloods taken and also some scans, but go and see your doctor to talk about this. It's not a normal thing to experience. It's very common, but it's not normal. So that's where you have to change your tampon more than every 2 hours. Now, if you also are getting clots bigger than the size of a 20-cent piece here in Australia or a dime in America, then this is also a sign that you need to go and get investigated medically. If you experience dull, constant pain in your lower abdomen and possibly heavy flooding bleeding and clots, these are also signs that there could be some growths in your lower abdomen. Now, this is a really important one. If you're experiencing rapid, unexplained weight loss or gain, this is also a sign to go and speak with your doctor. Particularly also if you have any family history of any hormonal cancers. So whether that's bowel cancer, breast cancer, uterine cancer, ovarian cancer, all of these are signs to go and speak to your doctor. Also, if you experience migraine headaches, so they're the ones where you get a headache and you can sort of see visual disturbances with an aura, and you're on the pill. So often what can happen if you are experiencing bleeding, flooding, medically they've done the tests, you don't have any growths that are cancerous, they need to cut out or radiate, what can happen is they might put you on the pill. That pill, if you are getting migraine or headaches, can actually increase your likelihood of stroke. So if you are noticing that you have migraine headaches and you're on the pill, you need to just go and speak to your doctor and seek alternative treatments for that heavy period. Now, there are surgical ways you can do that. There's uterine ablations, there's hysterectomies if we're talking about medical. But as you'll see when we get to the beige flags, we need to also understand, well, if it's not a cancerous growth that you need urgent care and attention for, we need to understand, well, why is there a uterine fibroid there? Why is it heavy in the first place? And that's where we think about functional, which is what we talk about when we get to the beige flags. Now, finally, red flags for perimenopause and also any stage of your reproductive life. If you are getting significant anxiety and depression to the point that it's debilitating you or there's suicidal thoughts, this is also time to seek help. If you are noticing that you get radiating pain down your legs, so around, sort of imagine where you would sit on a saddle, on a horse's saddle, where that pressure would be on your legs, on the inside or down the back of your legs, whilst also getting the dull lower abdominal pain. This is also a sign to go and speak to your doctor, because there can sometimes be growths in your uterus that are pressing on nerves in your lower back that actually cause that pain down your legs. So it's important to investigate with those things. Now, red flags when you are of reproductive age, meaning you're not in puberty and you're not in perimenopause. So it's roughly 8 years after your first period. So usually if you have a period, your first period's around 12 years of age. This is from 20 onwards until around 35 to 40. That is what I'm talking about when I'm talking about that peak reproductive age group. Red flags here is unexplained bleeding. So if you are noticing that you have red sort of smudging in your mucus around ovulation, that can be a sign I'm going to go speak to my doctor. If you are noticing that you have heavy periods that are going further than 7 days long, that's also a sign that we need to go and speak to our doctor. If you're noticing debilitating pain, that's also a sign to go and speak to your doctor. Now, what they're going to find, it's important to look at, okay, is this something that I need medication or surgery for? Because it could kill me soon. Meaning cancers, growths, so much debilitating blood loss that that's actually causing too much iron deficiency. So we're looking at those things. Now, if we think about beige flags when it comes to our menstrual cycle, if you are in puberty and you get your first period around the age of 9 or 10, this can be it's interesting because it's becoming more normalized in society because a lot more women are experiencing that. We're getting our periods earlier. And this often has to do with our BMI is generally higher because we have more processed foods. And also we have more exposure to xenoestrogens in our environment. Now, if you get your period around 9 or 10 years of age and you're quite tall, meaning you have that long thigh bone, that can be a normal, natural thing for you, particularly if you also notice that the women in your lineage or in your family also experience that as well. Now, if you are in perimenopause, what are some beige flags? If your periods are becoming heavier and you need to change your tampon, more than every 4 hours, that's a beige flag. So beige flags aren't a sign that you need to go and see your doctor. Beige flags are a sign that, your fundamentals are off. And your fundamentals are your nervous system, metabolism, nutrients, and blood sugars. So when your periods become heavier to the point where you need to change them every 4 hours, or you're noticing that your bleeds are longer than 7 days, but they're not necessarily debilitating, that's also a beige flag. If you feel like you get increased agitation around your period or quite low moods, that's also a beige flag. That's not a normal thing. That's not a green flag. That's a warning sign from your body. It's a warning sign that your fundamentals are off. If you're noticing pain, that's also a warning sign. Now, if you get breathlessness with your period or around your period, this can be a sign that you've got low iron. That's a beige flag. And if you're noticing that you lack motivation and stamina, that's also a beige flag. These are some signs that your hormones are out of kilter, not to the point that it's being caused by an abnormal growth in the uterus, ovary, adrenal glands, brain. It's to the point that it's not significant to need medication or surgery, but it is significant enough to have to listen and address it and go, this isn't normal. Now, what is a beige flag for a reproductive time frame? or reproductive age. So if your period is shorter than 21 days, so the whole menstrual cycle, so from first day of bleed to the next first day of bleed is shorter than 21 days, that's a beige flag. If it's longer than 35 days, that's also a beige flag. If you notice that you have those irregularities, or the shorter or the longer ones, and you also get cystic acne on your face, or you also get random hair growth on your face, chin, chest, nipples, that's also a sign of a beige flag. There's something off. Your body is saying, hey, we need to support our fundamentals. If you're getting pain that is putting you in bed for the first 1 or 2 days of your cycle, that can be common. It is not normal. That's a beige flag. We need to address that by looking at your fundamentals. If you're getting period poos, meaning your period becomes a little bit more sloppy around the time of your period, that's also a beige flag. It's a sign that you have heightened what we call levels of prostaglandins. So these things can actually loosen smooth muscle, which your bowel is a smooth muscle, and it's an inflammatory chemical in your body. So we want to be able to help reduce that. So beige flags, it's less than 21 days or it's more than 35 days. You're getting pain that's stopping you from being able to do things, or you really have to push through. You have to take a Nurofen or a naprogesic or something to decrease the pain. These are beige flags. If you're noticing that you get hair growth on your face, hair loss on your head, cystic acne, these are beige flags. If you notice that you have lost your period, so it didn't come, this is teetering on a beige to red flag. Now, you want to make sure if you're sexually active that you could be pregnant, so you're doing a pregnancy test is the first thing. If it goes absent, then think about, okay, what's been going on in your life? Has there been significant stress? Nervous system fundamental. Have you been over-exercising and under-eating? Blood sugar fundamental and nutrient fundamental. Have you been traveling a lot and changing time zones? What type of sunlight and rhythm you're under? That's metabolism fundamental. You know your body better than anyone. So why do your test results say everything's normal when you don't feel normal? Fatigue, bloating, period pain, mood swings, anxiety, these aren't random. Your body isn't broken, and these symptoms aren't just something you have to live with. They're signals that something deeper is going on. That's where Test Your Fundamentals comes in. Using a hair tissue mineral analysis, or HTMA, this test gives you a 3-month report card of how your body's been functioning, internally and externally. It shows you exactly what's happening beneath the surface, so you can stop guessing and start listening to your body in a different way. Unlike standard blood tests, HTMA reveals nutrient imbalances, heavy metal exposure, and deficiencies that could be impacting your energy, hormones, metabolism, and mental clarity. It doesn't just tell you what's happening, it tells you why. With Test Your Fundamentals, you'll get a personalized HTMA test, an easy to understand breakdown of your results, access to practitioner quality supplements tailored to your body's needs, and lifestyle recommendations to support all 4 of your fundamentals, so you can take action that actually makes a difference. If you've been told that everything looks fine, but you know something isn't right, it's time to dig deeper. Visit femalefundamentals.com.au to order your Test Your Fundamentals hair test today. There's also a link in the show notes. It's not what's wrong with me, it's what's my body trying to tell me. Then we think about your green flags. So what are the green flags? Now, if you get your first period between the age of 11 and 14, that's typically a green flag. That's when we typically will see that we get our period, our first period. If you are getting your period later than that, that can be a beige flag. It can be a common thing if you are very fit and active and sort of like an athlete in your teen years. That can be generally a sign that you're going to get your period later. But again, if you're getting your period after the age of 16, your first period, it's often a sign, particularly if you are highly active, that you're under eating, that you need to fuel your body more for the amount of exercise that you're outputting. Green flags is that your cycle length in perimenopause, this is a green flag for perimenopause, actually starts to lengthen, because in perimenopause, what's happening is that your brain and your ovaries are communicating, but the ovaries are like, hey, we're running out of eggs that are quality that we want to be able to ovulate. So I know, brain, you're telling me to ovulate them, but you know what? We're running low on stock. So what happens is the length of your cycle, your entire cycle from first day of bleed to the next first day of bleed, increases. So it can sometimes shorten, but if it's generally getting longer, that's a green flag. If it's all over the shop and you're also noticing fatigue, heaviness in your lower abdomen, heaviness of bleed, those things, that's a beige flag. That's actually not normal. It's a very common experience in perimenopause, but it's not normal. And it's a sign that we need to support your fundamentals. Green flags in terms of a reproductive age, or that peak reproductive age, you have a period between 21 and 35 days in length. The bleed of that menstrual cycle, the period, so we call it, is between 3 to 5 days, ideally. If it's any longer than 7, beige flag territory. If it's any shorter than 3, that's also beige flag territory. So ideally 3 to 5 days is your sweet spot of a green flag. A green flag is you'll possibly notice mentally that you'll feel a little bit down or slightly agitated a day or two before your period. If you're noticing that you are more agitated than usual, that people around you avoid you, or that you can't sleep, that you have significant negative thoughts about things, that you just don't feel like yourself, that is not a normal thing. That's a beige flag, not a green flag. Small, tiny shifts and changes like, oh, I cried in that random ad that I wouldn't have normally cried at. That can be a normal thing because what's happening is our hormones are at their lowest just before our period comes. So to sum it up, green flags from your menstrual cycle as a reproductive age woman, you want your cycle to be the entirety between 21 and 35 days. Ideally, you want that to stay regular. So around 28 days is the sweet spot, and you want it to be give or take 1 or 2 days of that same rhythm every month. So if you normally get a 28-day cycle, you want it to be either 26 to 30 days every month. If you normally get a 28-day cycle and then you get a 22-day cycle, that's still within the normal 21 to 35 days, but it's abnormal for you. We want it to stay within that 2 days either side of that. So that's green flag. Also, your bleed is between 3 to 5 days. That's the ideal. If it's longer than 7, beige flag. If it's shorter than 3, beige flag. If you are noticing that your skin slightly changes, it can get dry, slightly oily, those are green flags. If you're noticing breakouts, beige flag. Mood shifts and changes. Slight mood shifts and changes where you might go, oh, I probably wouldn't have reacted like that when I was ovulating, but now with my cycle, I am feeling a little bit more down in the dumps, or I just don't feel like I have the mental clarity as much as I do, or the motivation. That is normal. But if you're noticing that you're more anxious, more depressed, feeling like the world is crumbling, you're feeling hopeless, those things, that's a beige flag. It's a sign that your fundamentals are off. Fundamentals are nervous system, metabolism, nutrients, and blood sugars. So things like endometriosis, things like polycystic ovarian syndrome, things like PMDD, these are all beige flags. They're words or diagnoses that have been given to beige flags. So what do we do when it comes to beige flags? Well, this is how you fix your period by listening to it. So when you're in beige flag territory, which is, to be fair, the vast majority of people that I know will experience some beige flags with their period, but they think they're green flags. So if you're like, oh yeah, I don't really like my period because it's heavy, or I don't necessarily really know when it's going to come, or I always break out, I can't sleep well, I'm craving things like crazy, I want to rip people's heads off, or I feel so down in the dumps, these are all signs that you have beige flags and you need to care for your fundamentals. If you have been diagnosed with endometriosis, polycystic ovarian syndrome, PMDD, you need to support your fundamentals. Yes, there can be medical things that can help you with that, but the underlying physiology or cause, we need to support your fundamentals in conjunction, because There's a lot of people, for instance, if we take endometriosis, that can have a laparoscopy, have that endometrial tissue removed, and it grows back. Why it grows back? The environment that grows in, providing we always think that the body is the solution, not the problem, is trying to tell us something. The environment that grew that endometrial tissue is still there. So how do we change the environment? How do we support the environment of our body? Well, we support it by giving it what it needs, which are those 4 fundamentals. So if you're noticing these beige flags, what do? Nervous system, going to give you one thing. This is calling for your body to have more spaciousness in your day. So whether that's you're not rushing around as much in the morning, whether that's instead of fully booking yourself out on your weekends, you're actually allowing for more space in your day. Whether that's instead of leaving it to the last minute to leave your house before you go to your gym workout class or before you go to work, you actually allow more time for that to come about, or you allow space in your day where you haven't booked it. So this is what I mean by spaciousness. That's one of the main things that will help your nervous system fundamental. In terms of metabolism, this is really important, particularly if you're noticing irregular cycles. Metabolism is sunlight. Get your sunlight rhythm locked in. So first thing in the morning, you are avoiding artificial light and you are having the sunlight on your skin. That's first thing. In the middle of the day, get outside, eat your lunch outside, expose your body to the sun in the middle of the day. And then at the end of the day, ideally, if you can, seeing the sun set. So this actually helps to set the master clock of your body, which is the sun. The sun is the master clock of the world. If you think about how we measure time and how we know when time is happening. So if you can get the master clock, the sunshine right in your body, the other clocks and rhythms in your body work better. What's another rhythm and clock? Your menstrual cycle. So support your metabolism by getting out and seeing the sun rise, middle of the day sun, and end of day. When the sun is down, try and avoid bright lights, screens as a general rule. Then when we think about blood sugars being in a ketosis diet can be really helpful for people that particularly have polycystic ovarian syndrome or symptoms of that, meaning irregular cycles, cystic acne, hair growth where you don't want it, like on your face, chin, chest, nipples, and hair loss on your head. So if that is happening, then really what we want to do is support our body by supporting our blood sugar in that state. Ketosis is a great thing. If you don't necessarily want to go crazy in ketosis, just make sure every meal that you have, you're prioritizing fats and protein. You can have a little bit of carbs, but it's never a meal that is just carb-centric. So even though it might be something that's like a beautiful salad and it's vegetarian, great, but likely the protein and fat component of that is quite minimal and it's all carbs. So when you can satiate your body with fats and proteins, it actually helps to level out your blood sugars. And that is really, really helpful, particularly if you're someone that is getting PMS or PMDD-like symptoms or the PCOS-like symptoms, which is that acne, hair growth, oily skin, and pain with your period. So if you're noticing them, really focusing on proteins and fats in your diet. Lastly, nutrients. So nutrients, there's vast majority of nutrients. Some examples with specific symptoms. If you get period poos, often that's a sign that you're deficient in magnesium and B6. If you're getting heavy periods, often that's a sign that you have high estrogen. High estrogen goes with high copper. In order to balance that out, we want to support your liver and support balancing out the copper. So something like zinc and supporting your liver. There's different herbs that can help with that, things like milk thistle or globe artichoke, molly zinc, which is molybdenum and zinc. They all help your liver work better. If you're someone that's fatigued and exhausted and you have heavy periods, it's probably not going to be a surprise that you might have low iron. But again, we have to understand why you have the low iron. And it can be linked to that high copper, which makes your lining of your uterus thicker. When that's thicker, you lose more blood with your period, and that cycle continues. So if you want to know exactly what you need without blindly supplementing and wasting time and money on doing that, this is where I recommend doing a hair test. So a hair test, I've spoken about it a lot before. If you haven't already read my book or been on the website, Hair test is a really helpful tool to help you understand how all 4 of your fundamentals are operating and working, but also it tells you exactly specifically what your nutrient balance is doing, which helps you understand liver function, thyroid function, adrenal function, immune function, heavy metals. It's going to help give you a personalized view inside your body. It's sort of like a diagnostic tool. It's really, really helpful when we're looking at your functional health. But just some key takeaways: period poos, generally magnesium and B6. Heavy periods, generally your copper will be high, zinc will be low. Those are some really great tools and tactics to think about. Now, if you do have irregular cycles, there's an episode that we recorded with Melody. She talks about her thyroid issues and how she wanted to fall pregnant. If you haven't already, I would highly recommend listening to that. She speaks about her hair test, and it was actually really surprising. She had extremely high levels of arsenic, and that was actually what was causing a lot of her symptoms and issues. So, long story short, listen to your body. If you're getting those red flags, go and speak with your doctor and get further testing. If you're getting beige flags, it's time to support your fundamentals. If you're getting a bit of pain from one cycle, but the other cycle it was fine, that means it's time to listen to your body and focus on those fundamentals. What's your stress levels been? Have you had some time to yourself that month? What's your diet been like? Have you been eating some processed foods or more sugary foods, more carbohydrate-based foods? What's your sunlight regimen been like? Have you changed and been going to the gym really early in the morning before the sun comes up and you're under artificial light, or are you doing night shift? What's your nutrient level like? Have you been starting a different supplement or not taking different supplements? Have you been dehydrated, not getting enough electrolytes in? So this is where you just start to get a little bit curious about, well, what is my menstrual cycle actually trying to tell me? And I wanted to just finish on green flags and your energetics. So green flags, that's a sign that your fundamentals are well taken care of. It's a great sign from your body that, hey, you're doing a really good job. And when it comes to the energetics of your menstrual cycle, if you think about your menstrual cycle and in particular the bleed component, the period, this is a releasing and a letting go. So if you notice, and I notice this with myself, if I know that I've cared for my fundamentals as best I can that month, and I'm experiencing lower moods or more anger, agitation, or there might be a little bit more pain, I often think, what am I struggling to let go of? Or is there something that I'm doing that I feel like I have to keep doing that my body's actually saying, hey, don't keep doing this. We don't like it. It's out of alignment. So this is what I think of when I think of listening to my menstrual cycle, this symptom from my body, energetically. So think of it like it's releasing, it's a letting go. What are you not letting go of or holding on to because you feel like you have to do it? So I'll let that sit with you. Thank you so much for listening. If you have found this helpful, share it with any woman in your life and come back to this the next time you're thinking, wait, is this normal? Is this not? What do I do? Hopefully this helped you get a lot clearer on what your menstrual cycle has been telling you and how you can harness the power of it to listen to your body differently. Until next time, I'll see you later. If this episode resonated with you, take a moment to think of the woman in your life who might need this too. Maybe it's a friend who's been feeling exhausted, a sister searching for answers to chronic symptoms, or someone who just needs the reminder that feeling good in her body is her natural baseline. And if you haven't already, subscribing is the best way to spread this message and make sure you keep getting the answers and resources you need. Together, we're redefining how women connect with their bodies. And I'm so grateful to have you as part of this community. So, I invite you to get curious with me. If your body isn't the problem, it's the solution, what do you think your body's trying to tell you today? Please remember, this episode is for educational purposes only. Always consult a qualified health practitioner before making any medical decisions. Every body is different, And so is every healing journey.